My name is George Williams, and I'm Vice President of Community and Government Affairs at TAS, Inc., that's Treatment Alternatives for Safe Communities. I've worked with the Senator for a number of years. She and I, as a matter of fact, met each other back in the late 80s. We worked together at HRDI, and over the years, our pathway has always intersected. And so she called me and asked me if I would help facilitate this process because she is on her way. As a matter of fact, she should be in Belleville as we speak. A very, very, very dear friend of hers passed away unexpectedly, and she just was torn between being here and being with her friend and then calling this off, and she felt that she couldn't call it off, and I felt the same way, that the people needed to hear what's happening in Springfield, and so she said, well, could you go in and help facilitate this? And I said, of course. And so I consider it to be a great honor and privilege to be amongst this distinguished panel, but also to be with my peers from probably various sectors of the work that we do, from different reasons of maybe citizens and agency organizations and leaders from across the city and maybe even from across the state. Also, for a number of years, I was a registered lobbyist in Springfield. I also do some of those things in Washington, D.C. as well. And so the Senator felt that we have someone that can help move this process along to bring information from Springfield to the district and to have insights from this distinguished panel so that we can be informed about the process. As we all know, there is a serious budgetary process that is unfolding as we speak in our state. In Springfield, there are discussions taking place at the executive level, the governor's office, as well as at the legislative level with the Senate and the House and so forth. There's usually, in terms of timelines, usually right about now in Springfield, we will usually begin to see substantive budget bills starting to come out, and we can take a look at those things and start to make comments, and we have hearings and so forth and so on. The bills will come out of the House. First of all, the governor introduces his budget bill, then the Senate and the House look at that bill, and then they may respond with their own bills. And right about now, usually in Springfield, we will usually see some things in motion as session begins to end at the end of this month by May the 31st. Well, there's a lot of discussions going on. There's some things that have taken place in the House as we talk about possible budget recommendations. As you know, Speaker Madigan, he introduced a number of amendments that has gone through the process that will restore some of the cuts that has been suggested by the governor for FY16. And last night I was in a long conversation with Senator Hunter regarding what was going on and that she may have some insights since she is part of the leadership, the Senate leadership, and she says, George, things are really moving very slow. It's looking as though as of today, if she had to make a call, that there may be overtime, that the governor may keep them in. But just as recently as this week, there was comments made that, we can get this done in a matter of days. It doesn't take long to get this done, so forth. But so she felt that the people need to be informed, and this is what this is about today, to inform you and to help you shape your thinking and your activities and so forth and so on. And so we will proceed. We also are awaiting the arrival of Ken Duncan, State Representative Ken Duncan, who was the past joint chairman of the House and Senate Black Caucus, who knows the landscape, who can give us a clear update on what took place as recent as yesterday, particularly from the House perspective. And he will also take part in following up and getting feedback and kind of wrapping things up today as we wind down. So with that said, I'm going to turn the mic over to Ralph. Ralph, I've been following you for a number of years. It's like when you speak, it's like Moses speaking. When we talk about the budget, trust me, and you've been saying things for a number of years about where the state is heading. And so we're going to ask you to lead us off. And so I like to kind of think of Mr. Mattie as Moses of the numbers. He knows the numbers. He knows and he has made some clear recommendations over the years. And so we're going to hear from He's going to lead us off. We're going to ask that our folks speak for about maybe 10 minutes, 5 minutes, 8 minutes apiece, and then we'll come back with questions and answers and recommendations and so forth, and then we'll get all this information to the senator as we wind things up, hopefully by 12 o'clock. Okay? Thank you.
So that means we only have 25 years left to solve the problem. So I've only been wandering in the wilderness for 15. So math is math. If you could start this slide up. A lot of folks hear these big numbers and don't translate them to what they mean for the state of Illinois or what they mean for public services. So what I thought is I'd give you a snapshot of the state budget, Governor Rauner's proposal, and why his proposal makes no sense and won't happen. So start off with where we are, the very top line. See that 6.6 number? That's $6.6 billion. That's the accumulated deficit that carry forward from 2015 into the current fiscal year, 6.6 billion. That's a lot. Then the next number under there is 4.7 billion. That's the cost in lost revenue from the phase down of the temporary tax increase. So you all know we had this temporary tax increase that passed a few years ago. It's now phasing down. So for instance, the personal income tax rate just went down from 5 to 3.75% as of January 1 of this year. That will cost us $4.7 billion annually in recurring revenue, felt fully for the first time here in 2016, the year they're trying to put a budget together for. So that means our collective whole walking into the year is $11 billion, 11.3. Now the governor has said, all right, I'm going to close 2 special funds on the outside, take the revenue that was in those funds and stick them into the general fund for services. So $900 million from one, $200 million for another. That cuts the hole by $1.1 billion, but it still leaves a $10.2 billion hole. Remember this number, because this effectively is really where we are. Now we get to the part of the governor's proposal for 2016, which we at CTBA call Fantasy Island. Not going to happen. $2.2 billion in pension savings. These pension savings would materialize if he were able to push every current state worker into the Tier 2 program, which provides a significantly lower benefit than Tier 1. The state Supreme Court just ruled you cannot do that. So I know the governor's been making public statements as if, well, it's unclear, but there is nothing unclear here, okay? He can't do it. He won't be able to do it. That $2.2 billion in savings isn't going to happen. Next, there's $900 million in savings from cutting money that goes to local governments. This comes in 2 forms. Something called the Local Government Distributive Fund, where the state shares its income tax revenue with local governments. He wants to cut that by $600 million. And then he wants to cut grants and funding for transportation and transit by $300 million. So that would be $900 million in savings if the General Assembly goes along with it. Chances are it won't go along with it, and here's why. A few years ago in 2010, the state passed a law requiring local governments to ramp up their funding for their police and fire pension systems, imposing a really significant and big cost on local governments. At the same time they're imposing this big cost, they're going to cut revenue to local governments. So what? There will be no police and fire services delivered at the state? So it's just a silly proposal. It's bad public policy, probably not going to happen politically. Then there's the cut to general fund services. And these are primarily 3 service areas, $1.5 billion of cuts. They are social services, they're Medicaid programs for low-income families, and it's higher ed. Those are the 3 big areas that get whacked. Well, the House just had a pro forma vote on the governor's proposed cuts to human services. That didn't go so well. In fact, it didn't get 1 positive vote. And it's unclear that he would get votes for any of the other cuts. Interestingly enough, the Medicaid cuts that he's putting on the table, some of them he could do just by law pretty easily, reducing the reimbursement rates. Many of them, however, require the federal government to approve the cuts because Medicaid is a joint federal-state program, right? Well, the federal government has already said no to all these proposed cuts when we tried to cut them a few years ago with the not-so-smart SMART Act. So net, it's unclear that any of these cuts will materialize. That means, at most, out of what the governor's proposed to cut, he might get $500 million, $600 million there. Nowhere near the billions he has on the table, which means our deficit remains at $10.2 billion. You go to the next slide. Here's why that's a problem. Over the last 40 years, the state spends its service money on 4 things. 9 out of $10 go to education, healthcare, human services, and public safety. That entire $10 billion deficit is in what we spend on these core services. So what we spend on services is 9 out of $10 goes to education, health, human services, and public safety, right? We only spend $24 billion on that out of our $35 billion general fund. The other $11 billion are hard costs, things we have to pay by law, like debt service, et cetera, no discretion. So think about this. We've got a $10 billion deficit and a $24 billion budget for education, health, human services, and public safety. It's approaching 50% of what we spend on services. That's really not sustainable. And a lot of folks have said, well, we need to control that spending side of the ledger before we could deal with new revenue or revenue again. Well, they've dealt with the spending side of the ledger. This is from 2009 to 2015, nominal dollar expenditures on those 4 core services, education, health, human services, and public safety. Look at the trend. They've cut them significantly by well over $3 billion. And that doesn't adjust for inflation, so it doesn't show the real impact. Here you see a modest bump up. No real bump up in service spending at all. It's 2 things. Remember I told you the federal government said no to a number of Medicaid cuts we tried to impose under the SMART Act? That's slightly more than half of this bump. We cut the services here, and then the Fed said, no, put them back in here. So we had to put them back in by law. And the rest of it, the state carries a health care program on state workers called group health. They've never, ever, ever, ever budgeted the actual cost for their group health program. They always under budget it just to make them look healthier and like they have more revenue, even though their actual cost, their actual liability is significantly more. So Senate President Cullerton a few years ago said that that's really not the most transparent way to do a public budget. Let's start ramping up group health costs in the budget so we could be honest with the taxpayers about what it's really costing. That's all that's in here. The more honest budgeting on group health and the denial of Medicaid cuts by the feds. There's been no voluntary increase in expenditures on services at all since '09. There have been significant cuts. What has grown in our budget? Real simple. Those hard costs I mentioned, the things over which there's no discretion. There are 3 of them. Debt service that we owe to banks and bondholders. That's this little blue bar. It's grown from $1.2 billion in 2010 to $2.2 billion now. The red bar, these are statutory transfers out. This is what by law we have to take from our general fund and transfer to other funds. There are 2 big ones here. There are some Medicaid trust funds that we have to finance in our deal with the feds. That's over $1 billion of those transfers out. And the other is what? The local government distributive fund, where the state shares its income tax revenue with local governments. That's another $1 billion. So by far and away, most of this are those 2 transfers. And then here's the big gray bar. That's the pension contribution. Look how that's grown. But I want to be very clear about that. That pension contribution growth has nothing to do with pension benefits. In fact, the pension benefit cost included in this now, 6.8, it's going to be about 7.1 billion this year now that the law was ruled unconstitutional. But the actual pension cost in there is only about 1.5 billion. The rest of that, 5 billion plus, is repaying debt that the state borrowed from the pension systems over the last 40 years. So what the state has been doing for decades is trying to paper over the fact that there is a mismatch between its revenue growth and its service cost growth. Every year, because our tax policy doesn't work in a modern economy, what we have in revenue growth is not enough to sustain the level of services provided in the prior year. And this has been going on in Illinois for decades. So for decades, rather than fixing the problem by dealing with revenue policy, tax policy, the state has said, all right, what we're going to do is borrow against what we owe the pensions, write an IOU to the pension system that bears interest, by the way, at anywhere between 7.6 and 8.5%, depending on the system, compounds annually. We'll write these IOUs to the systems and use the money that should have funded the pensions to fund services. What does that mean? Well, it means we, as taxpayers, have never paid the actual full cost of the services we've consumed. Education, health, social services, and public safety have been subsidized for decades by the pensions. That's number one. Number two, we got to pay it back. We have no option. The Supreme Court's made that clear. Our Constitution makes that clear. We got to pay it back. Number three, the payment back plan for it, which was passed in 1995. Look how low the payments were in the early part of the 2000s. Look how high they are now. The payment plan that was passed for this debt back in 1995 was, and this is a technical fiscal term, so stay with me, goofy. It was ridiculously backloaded. So what they did was, by law, even though they told the state they were being responsible with their funding of the pensions, and they had this new law that if they funded it within 50 years would get the pension systems healthy, it was a lie. For the first 18 years of that pension funding law, they simply codified the practice of borrowing against the pensions to fund services. And they so backloaded the payments as to make them impossible to reach, unaffordable, unattainable, and also after they were out of office. We are now hitting that unattainable, unaffordable ramp, and it looks like a ski slope. And anyone here that has a mortgage, did you design your mortgage so that every year the payments jump at a way that you can't afford? No. You've got a level dollar amount for your payments, right? That's what they should have done. They didn't do it because it would have cost a little bit more up front, and they would have had to stop borrowing against the pensions. They didn't want to do either. This entire problem with the pensions is a debt problem, and it exists because we have lousy tax policy, and it's designed to cover up our lousy tax policy. It's got nothing to do with the benefits themselves. So here's what we're doing to ourselves with revenue. This is what the annual revenue for our general fund that goes to those four core services is going to look like with the phase down of the temporary tax increase. Notice it went from $36 billion in 2014 to just $32 billion in 2016. And we've already got a $6 billion hole, and then we're just giving away another $4 billion in change in revenue. Really? The first thing you need to do if you're in a ditch and you want to get out of the hole is stop digging. We dug deeper by policy decision. All right. Now, who's that benefit? Not middle-class taxpayers. So we now know that this tax relief, this tax cut, is really hurting the state, and it's imperiling its capacity to fund those four core services. Who's it helping from a people standpoint? Who gets the benefit of this tax break? You look over here, this is the bottom 60% of taxpayers in Illinois have $35,000 a year or less in taxable income. Taxable, this isn't your grossing, this is your taxable income. This is how we could get the data from the Illinois Department of Revenue. That bottom 60% of all people in the state only get 13% of the tax break. The wealthiest 11%, and that's how we had to cut the data. Once again, we couldn't get it to the wealthiest 10 because Illinois doesn't keep the data that way. They get 54% of this tax break. You want numbers? So the bottom 60% get about $490 million. The wealthiest 11% get over $2 billion of the tax break. You know who does really well? Millionaires. People with taxable income of $1 million or more. Remember, this isn't their gross income. This is taxable. This is after deductions and everything else. People with $1 million or more in taxable income got 13% of this tax break. They're 0.2% of our state population. Really most interesting, their average annual tax break for millionaires is roughly $37,000, which is more than the bottom 60% in our state make in taxable income. This tax break, which harms the state's capacity to fund core services, is a boon for millionaires and the wealthiest 11%. And we're paying for this significant tax cut to the top by cutting services consumed by the bottom and middle. Someone's got to explain to me why that's rational fiscal policy, because I don't get it on any level. But it is being sold to us as something that benefits the middle class, and nothing could be further from the truth. This is something that helps destroy the middle class and the lower working income classes. Period, end of story. All right, so I looked back long term. Because who's heard a politician say, let's solve our problems with across-the-board cuts? Anybody heard that sort of stuff yet? You know what? We've gotten that. We've gotten across-the-board cuts. Between 2000 and 2015, this is state spending on services adjusted for inflation. Look at every single one. Healthcare, pre-K through 12, higher ed, all cut, all spending less in real terms after inflation today than we did in 2000. The state of Illinois is making the conscious policy decision to disinvest in education, health, social services, and public safety. It is making this policy decision because its revenue choices, its tax policy, doesn't work. And rather than fix tax policy, they're selling us a bunch of rhetoric and cutting services that create social and economic justice. So, how do we solve the problem? Number one, we have to expand the state's sales tax base to include consumer services. That's absolutely has to be done. We need the tax revenue from that. If we did that, you'd generate anywhere from $1.7 to $2.1 billion in revenue, depending on whose estimates you believe. And you would not create a state that has magically become Taxachusetts. Now, here's why you have to do it. 47 states in America actually have a sales tax. And of those 47 states, we have the most narrow base. Why? We don't tax services, we do tax goods. This is goods, the red bar, as a percentage of the Illinois economy over time. It has declined to be just 17%. That's what we tax. Services are 72%. That's what we don't tax. Do I really need to explain why that doesn't work from a revenue generation standpoint? You simply can't leave the largest and fastest growing segment of your economy entirely out of your tax base and expect that your fiscal system will have a balanced budget going forward. You're not taxing the modern economy. That's going to create an imbalance between your revenue growth and your service cost growth, period, end of story. Now, I wouldn't tax all services. You wouldn't go after business to business. You wouldn't go after health care. You wouldn't go after professional. Just things like lawn care, haircuts, bowling, health clubs, that kind of thing. All of our neighboring states already tax services far more than we do. Iowa and Wisconsin tax all of them. Have you seen busloads of people from Iowa and Wisconsin coming here to get their hair cut to evade taxes? No. Now, have you seen their haircuts? They should come, right? Those are silly-looking people. But they're not coming here for tax reasons. It's once again, it's this empty rhetoric to scare people away from doing what's right. Now, here's the bad news about an expansion of the sales tax base, and I'm going to hit this on the head. It's slightly regressive. Takes a little bit more out of a lower middle income family's pocket than it does a more affluent family's pocket, right? And here's reality. If you have a choice, and especially given Illinois' fiscal condition, between a slightly regressive tax and a service spending cut, pick that regressive tax every single time. Why? Well, it's going to cost families money. Let's say this would cost families, low-income families, $100, $150 a year. That's food off the table if you're low income. No question, it's a burden. What's it cost that same family to see their child care services cut? What's it cost that same family to see their schools disinvested in and their children get no future? What's it economically cost that family to lose substance abuse or domestic violence counseling? What's it cost them thousands of dollars. From an economic impact standpoint, there's no question. If you have a choice, and we have very few choices here in Illinois, always pick the regressive tax. And that said, taxing services is slightly less regressive than what we currently have in our state sales tax policy, just taxing products. Think about it. The middle income family buys a lawnmower, right? Pays a sales tax on that lawnmower and does their lawn. The rich family in Barrington, they get a lawn service. They don't pay a tax on that service. More affluent families consume more services than do low and moderate income families. So even though this is regressive, it is significantly less regressive than our current sales tax. Right, next. Retirement income. 41 states, 41 states in America have an income tax. We're one of only 3 that broadly excludes all retirement income from our income tax. That doesn't work. In fact, in about 6 or 7 years, over 25% of our state's population will be at retirement age or older. So how do you tax retirement income without hurting low-income, fixed-income seniors? We figured out a way, and it's very doable. If some taxpayer has annual adjusted gross income of $50,000 or less, that top line, we wouldn't tax any of their retirement income. We'd let them keep the full exemption. So we've got, now you know that, by the way, 60% of the state has taxable income below $37,000. This right here cuts about 75% of the seniors out, right by doing that. So 75% of the seniors wouldn't pay any income tax on their retirement income. Then you phase out the exemption as incomes rise. So if incomes are between $50,000 and $75,000 a year, you would tax only a quarter of their retirement income. You'd still leave 75% of it untaxed. 75 to 100,000 in income, you would tax half of their retirement income with the state income tax. No one would pay the state income tax on all their retirement income until they had $150,000 a year in adjusted gross income. Well, they could afford it. And net, even this small tax generates over $1 billion in revenue. So we have to do it. It's too big of an exclusion. Has to be on the table. All right, two other little tweaks. We do have to increase our income tax rate up a bit. We let it phase down to 3.75% from 5%, causing that $4.7 billion in loss. That's way too much. We got to go back up. We don't even have to go all the way back up to 5%. 4.5% to 4.75%, somewhere between another percentage point or a little less than another percentage point, will do the job. Second, we got to deal with that pension debt. We got to get rid of that backloaded payment plan, and we got to level it out. We can do that, by the way. We've run the numbers in a way that works. In fact, if we do those things I just laid on the table, expand the sales tax base to consumer services, tax some retirement income, adjust the rate a little bit, and redo the pension ramp, the state eliminates its deficit within 2 years, completely. Within 3 years, the state could start putting over $1 billion more into public education. And in fact, within 3.5 years, can put over $4.5 billion more annually into public education, which is exactly what the data say K-12 education needs so that every child in our state gets a meaningful opportunity to learn. Oh, and we could put another $250 million into social services, which have been eviscerated over the last 15 years, and we could do all that and still keep a balanced budget. The net tax increase from what I just threw on the table is about $4 to $5 billion. It'll be in that range depending on the mix they pick, right? That sounds like a lot of money. The state of Illinois has a $720 billion economy. It's less than 1% of our economic activity. It's not even measurable at such a small tax increase. We are letting a tax increase, which is less than 1% of our economy, stand in the way of actually solving our state's fiscal problems and creating enough fiscal capacity so that we can invest adequately in social services and public education. We just can't afford to ignore tax policy anymore. So I don't know how many of you got up this morning saying, I can't wait to talk about how great taxes are, but I hope all of you leave here saying that, because without fixing tax policy, we can't solve our problems. Thank you.
Now you see why I called him the Moses. I mean, he has really led this discussion from over a number of years, and Ralph, thank you very much for that very informative presentation. Let me ask you, did you bring this with you? Is this on the table, this presentation, or on your website?
We could certainly send it to whomever, Mattie Hunter's
Okay.
office, whoever for distribution.
Okay.
We have a far more detailed PowerPoint.
Yes.
We'd be happy.
Yes, this is excellent. Yeah. Would you guys like to have this here?
Yeah.
Okay, wonderful. So then we will make a way for that to happen. Make sure you sign in so we can get that to you, as well as maybe Ralph could post on his website as well. Excellent. Thank you again very much. Next, we have Dan from the, that's going to bring us his perspective from the private sector.
Well, I've got to say, I don't like having to follow Moses very much. That's not very fair, but I'll do my best. So Ralph has given you a terrific overview from 30,000 feet of Illinois fiscal policy and how it works and how budgets work and how revenues and spending are the two sides of the coin here. So what I'm going to do, what I was asked to do, was to get a little more down to the ground level and look at some of the specific proposals Governor Rauner has made. But I want to emphasize, I want to echo actually what George said at the start, which is where we are in this process. Governor Rauner proposed cuts to the Illinois budget for fiscal year 16, which starts on July 1st, so that's what we're discussing, the budget going forward from July 1st. He made his proposal in February. It then goes to the General Assembly where it is now. General Assembly considers his proposal, looks at his budget, it can accept it, it can modify it, or it can reject it. We want them to reject it in whole. We think there's no merit to his budget proposal, and that seems to be the direction in which things are moving. But as George said, it's really up in the air right now. We're not sure what's going to happen. There have been a few votes on the floor, but not on the whole budget, just on small pieces of it. So we're kind of in, you know, at that stage in the process where nobody really knows exactly where it's headed. But I want to make sure everyone is on the same page here. What I'm going to describe are the governor's proposals, okay? None of these have gone into effect. None of these have been approved by the General Assembly. This is what we're fighting against. But I want you to understand what it is the governor has proposed. So what we've got here is a long list of the dollar amounts of various cuts, and what I'm going to do is just give you a little, hopefully a little insight into what it means, because these numbers don't probably mean a whole lot. Is that a big number, small number? Should I worry about this? So I'm going to try to give you a sense of what those numbers mean in terms of the actual service cuts that would result. So let me start with the first one, which is the $1.5 billion cut to Medicaid. So that is a big number. About half of that would be to hospitals, reimbursement to hospitals, which would really jeopardize the future of certain hospitals, especially those serving lower income communities. But there are some other specific things worth mentioning. It would eliminate coverage for adult dental, which is something that we tried a few years ago and found out that didn't make any sense fiscally. But Governor Rauner has come back to that, and if we were to eliminate coverage for adult dental services, it would mean more people would suffer, more people would have, with infections, would experience pain and suffering, would go to emergency rooms, and the treatment for that is pulling teeth, which can lead to further dental problems and make it hard to get a job. So what we found through this experience in the last few years is the cost of the emergency room visits exceeds any savings that would result from eliminating dental services. It costs about $600 to visit a community-based dentist. It costs 10 times because of dental issues. So it's so that's one thing. Another thing included in that is the requiring people, severely mentally ill people, people with bipolar or with schizophrenia, requiring them to get pre-approval to get more than 4 prescriptions. Well, routinely they need more than 4 prescriptions, and if you require prior approval, that could cause an interruption in their treatment. It can cause a relapse. They wind up in a psychiatric hospital, which costs us $20,000. And then one other thing I want to mention is the breast and cervical cancer program, which would be eliminated by Governor Rauner, and that would that consists of screening and treatment for breast and cervical cancer, and it would mean that to get treatment you'd have to come up with several $1,000s payments towards your deductible, and so people would be excluded with cancer from getting treatment under his proposal. All right, the cut to child protection, that's achieved by eliminating all services to 19 to 21-year-old wards of the state. So DCFS would no longer provide services. Now the main service provided to 19 to 21-year-olds is housing assistance. So we're talking about greatly increasing the homeless population among the 2,400 current wards who are in that age group. Cut to public transit, well, that's the CTA, and that's a very substantial cut, and it will, if approved, it will undoubtedly lead to service cuts and fare increases. Public universities, that's a 31% cut in funding to all state universities. 31%. We don't know exactly how the universities will react to that, but I think we can guess that it's going to have an impact on tuition. $82 million cut to mental health treatment. So the next 3 are to really vulnerable populations: people with mental health issues, people with substance abuse issues, people with developmental disabilities. All of those are significant cuts in services. Sure. All right. Moving on, so the next thing is, this is in-home care. So this is a very large cut. I believe it's about a third of people with disabilities. Does anyone know for sure? Who would be excluded from the Community Cares program, which provides in-home care, so people who are elderly or have disabilities can stay in their homes. This is a huge cut. What will happen is that people who can't get these services will deteriorate. Their conditions will deteriorate, and they will become eligible for nursing homes, and that, of course, is far more expensive. There's kind of a theme here, right? Doing things that will result in much greater cost later. Now, the governor's stated goal, what he says, why he's proposed these cuts, is to save money. But when you do this analysis, a little closer, when you do this analysis, you see that he really isn't going to save any money. So what is his goal here? It's hard to discern. Okay, the cuts to child care. So that's the program of subsidized child care, so parents can work and go to school, that we have here in Illinois. It's a great program. It's a big program, about 160,000 children in our state. He wants to cut it in half or more, and three ways he would do that. He would require parents to pay a greater share of the cost of care. He would eliminate relatives from being paid child care providers. So if you're related to the child, currently there are a lot of relatives, grandparents, aunts and uncles, cousins, who provide care and receive a small amount of reimbursement for that. He would eliminate all relatives from being eligible to receive assistance through the program. And the big change would be that there would be no child care for children over age 5. He would eliminate all school-age child care, meaning that you're 6 or older, you're on your own after school. And these are the funds that often finance after-school programs in the schools. So not only could you not go home, but there'd be no program if you wanted to stay at school. All right, cuts to local government. That's going to be a lot of things, but it's certainly going to be police and fire, and that's going to affect every community in our state. And the cut to that funding line was 50%. Okay, that's why you're hearing mayors get up in arms. Big cut to or elimination of the heating assistance program. Let's see, smaller grants but important programs for autism, epilepsy, and so on. A couple of things not on this sheet that I want to mention. There's the Teen Reach program, which is after-school teen program. And it obviously keeps teens out of trouble. It helps them with schoolwork. That would be eliminated completely. 14,000 teens would be kicked out of these programs, at-risk teens. And the other thing I want to mention is the early intervention program. That's a program for children who are 0 to 3, so our youngest children who have developmental delays. And currently, if they're delayed from up to 30%, if there's a 30% delay in their development, they can receive services through this program. Governor Rauner has proposed increasing it to 50%. You'd have to be 50% delayed. That would do a couple of things. It would exclude about half the children, so about 10,000 children would no longer get services. It would also exclude those children who are most likely to catch up to their peers if they receive services. If you take the services away, they're going to need special education later, and that's going to cost 5 times as much as the early intervention services. So again, I think this gives you kind of a sense of the scope of things that the governor has proposed. But I also want to just get back to my original point and the point George made, which is these are all proposals. None of these are a done deal. I don't want you walking away from here depressed and saying, oh my God, look at all this stuff that's going to happen in Illinois. None of this has to happen. This can all be rejected. And I think we're kind of on our way to doing that. I think the public really does understand how horrific these proposals are. We're moving in the right direction, but we're not there yet. And it's going to take involvement by everyone to get there. And that also means you. I'm going to give you an 800 number you can call and for free, and it patches you through to your state representative and state senator. Now you can say, why do I have to call Senator Hunter? I mean, she's not going to be for any of this. She's going to be opposed to this. She's going to reject all of this. She's going to find it unacceptable. The reason you need to call Senator Hunter is because this thing is going to play out for a while, and there will be some cuts. There will be some cuts made in the end, and there will be hopefully lots of revenue that Ralph talked about. Where that needle's going to fall is going to depend on this political process, and somewhere along the line, John Cullerton, who's the president of the Senate, who's the head of the Senate, is going to come to everybody. He's going to come to Senator Hunter. He's going to say, have you been hearing from your constituents? Are they upset about this, about these cuts? And if she's honest, which she will be, she'll have to answer him. She'll have to say yes or no. And that's why it's not just important to get this message to people who are in the opposite camp, or people who are on the fence, or people who are not sure how they're going to vote. Even the people we know are with us have got to hear from their constituents. And, hopefully, what we're doing today will be enough to get you engaged in the process. So I don't want to send, many times I feel like I'm sending people away and they're kind of depressed because they've heard about all these horrible possibilities. I want to give you something you can actually do. So let me give you the number. It's 844-311-2887. And I'll give you that number again. If you call, it'll ask for your zip code. I just did it this morning to double check it. It'll ask for your zip code, and it will say, do you want to be connected with State Senator Mattie Hunter or whoever your state rep is, say it's Ken Duncan, or do you want to be connected with State Representative Ken Duncan? And then you'll go right to their office. You just leave them a simple message. It can be short or long. It can be short, your name, where you live. I care about the state budget. I don't want to see these awful cuts. We need to raise revenue, something along those lines. Or you can leave a longer message if you want and tell them, who you are and where you work, or what your experience, what program, what services you're using, why they're important to you. There's also, there's a possibility to email members to try and meet with them in the district. There's a lot of, ways that you can try to contact your member, but this is a really easy one. It won't take a lot of time. It's free, so I'd recommend checking that out. And, I'm sorry, the number is 844-311-2887. And, share it with your friends. Share it with your friends and family. Like I said, every single member is important in this process. Doesn't matter where they are on the scale of being for or against what the governor wants to do. So share this number with your friends, family. It works throughout the state of Illinois. Okay? All right. Last time. Not last time. I'll keep saying it as long as people want to hear it. It's 844-311-2887. Okay?
Just to give an update here. For those of us that have joined us late, kind of recently, just to give you an update, you probably look up and saying, where's Senator Hunter? Look like none of them guys look like Senator Hunter up there. And you're right, Senator Hunter is unable to be with us today. She's, one of her real close friends passed away unexpectedly last week. She was torn between being here or being at her services, and she had to go and be at her friend's services and with her family. And so she really contemplated whether to call this off or to keep this in place, and she decided to keep it in place. And she asked if we will come and facilitate this process and get you guys the information and get you informed and get you engaged, and so we can know where we're standing at and then conform and put together our action plan in terms of how you choose to follow up with this. So she really wanted to be here. She asked me to text her as things are unfolding, and so if you see me on my phone, I'm kind of texting her that it's going along well, blah, 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 because she really wanted to be here. But she's down in the Belleville area attending a very dear friend who had passed away. Yes. We will bring up probably a couple other folks as well as we kind of get through the panel here. One will be David Whitaker, who has joined us also, okay? So next.
Thanks. I'm Bob Palmer. I'm the Policy Director for Housing Action Illinois, and I'm going to talk about Governor Rauner's budget proposal and the state budget overall as it impacts efforts to create affordable housing and homelessness. And I'll just state right from the beginning that Governor Rauner's proposal is really bad for those efforts to end homelessness and create affordable housing. But I also want to add that for many years now, the state of Illinois has not adequately committed resources to efforts to end homelessness and create affordable housing. I think everyone in this room is well aware that we have homelessness in our society. The wealthiest society in the world is not good. It's wrong morally, but it also has huge costs. If you're an individual and you're homeless and you're out on the street, the chance you're going to wind up connecting with the police and winding up in jail or prison, being involved in the criminal justice system, is much higher. That has a huge social cost. If you're a family with children that's experiencing homelessness, it's hard for the kids to do well in school. So that also has a huge social cost. So we pay one way or the other. We have these huge social costs that are caused by the existence of homelessness. But we do know as a society how to end homelessness, and it's really pretty simple. When a family or an individual is at risk of homelessness, we should prevent them from becoming homeless with providing them with the small amount of financial assistance that they need to stay out of a homeless shelter, to not wind up on the street. So this is a proven, effective strategy. For those people who are already homeless, we need to create affordable housing with rents that people with the lowest incomes can afford to pay. So it's really pretty simple, but we haven't committed the public resources at any level of government, at the federal government level, at the state government level, at the local government level, to fulfill those strategies. So the state of Illinois doesn't spend a whole lot on ending homelessness and creating affordable housing. If you add up all the funding for the line items I'm going to talk about, it's like barely over $50 million. Most of the money comes from the federal government. I know we're not talking about the federal budget today, but there's also lots of bad things happening with the federal budget as in terms of supporting those efforts. But in terms of Governor Rauner's budget proposal, in terms of the little bit of money that the state does spend already, again, it's really devastating. And we estimate that over 12,500 people who are currently getting services from the state of Illinois would lose them under Governor Rauner's budget proposal. Most of the people in those category, over 10,000 of them, would be people who live in permanent supportive housing. And what permanent supportive housing is housing that has some social services, case management, counseling, to help people who need a little more assistance in order to stay in their housing to make sure they don't get evicted. On my way over here, I went past the studios at 18th and Wabash, which is a permanent supportive housing facility that serves people who are homeless. So the state is really crucial in funding for providing those services for the permanent supportive housing, for paying for the case managers, the property management staff, the other people who are working with people, again, to make sure people don't get evicted. And Governor Rauner is proposing to totally eliminate the state funding for permanent supportive housing targeted for homeless or formerly homeless individuals by cutting the spending on permanent supportive housing services from about $30 million to less than $15 million. The money that he's proposing to leave alone, which we're glad he's proposing to leave that alone, is for permanent supportive housing that's more focused on people who haven't necessarily been homeless, but they have severe mental health issues. But we know there's a lot of overlap between those populations, between people who are chronically homeless who need permanent supportive housing and people with severe mental health issues. So Governor Rauner has said a handful of good things. He's talked about wanting to help people move from nursing homes into community-based housing, and we totally support those efforts because it's the right thing to do, but also it's going to save the state a significant amount of money. So we applaud Governor Rauner for wanting to do that. But at the same time, if we're cutting services and permanent supportive housing for people who are homeless and they wind up losing their housing and becoming homeless again and winding up back in a nursing home or some other type of institution, that's not going to save the state any money. It's going to cost the state money. So we need to stop having, kind of a short-term, as Ralph was pointing out, a short-term attitude towards dealing with the state budget problems and thinking about the long-term costs. So that's one cut to permanent supportive housing services that we're very much concerned about. Another cut that we're very much concerned about, I talked about earlier, is when a family or an individual is at risk of becoming homelessness, we need to prevent them from becoming homeless in the first place. And the state has a really good program that helps do that. It's called the Homeless Prevention Program, which has been around since like 1999. So my group, working with other groups like the Chicago Coalition for the Homeless, advocated for many years to get funding for this program. And at one point several years ago, back in like 2008, the state was spending $11 million on this homeless prevention program each year. When the state started to have really serious budget problems after 2008, the funding for that program has gone way down. At one point, it was like $1.5 million from a high point of $11 million. And since that low point, we have slowly began to build it back up again. Funding for this year is about $4 million. What this program does is, and it's available all throughout the state, is it provides families at risk of being homelessness, on average, a grant of like $1,000 for families who have had a very temporary crisis, like loss of a job, a healthcare emergency, maybe somebody who's fleeing a domestic violence situation, to give them the money they need to get up to date on their rent, to pay back utility bills. If you're already homeless, you're eligible for this program too. And if the only thing that's keeping you homeless is you don't have money for first month's rent or a security deposit, can pay for that. It's a very effective program. The state surveys the households that receive this assistance several months after they get it. And every single year we find that looking at these households 6 months later, like 90% of them are still housed. So it's a lot more cost effective to provide that $1,000 grant to have somebody or a single individual or whole family go into a homeless shelter that maybe will cost $20,000 a year or more to pay for them to be in the shelter. Not talking about the social costs, about the impact on the kids' education, or the risk of somebody else going into an institution. So Governor Rauner is proposing to cut that line item from $4 million to $3 million, which means that about 1,000 households that would otherwise get that assistance are not going to get it, and they're very much likely going to wind up being homeless, getting evicted. That's a whole other social cost of homelessness I haven't talked about, is that all the people who are really desperately trying to avoid eviction in order to stop from being homeless. And so a lot of those people wind up in the court system. It's a huge cost to the courts. So we are part of the bigger coalition that is working with Ralph and Dan and other groups to try and advocate for the revenue that we need to make sure that we can provide adequate funding for the homeless prevention program, for the services and permanent supportive housing. A line item I didn't talk about is also homeless youth line item that funds programs around the state that serve teenagers and young adults who are separated from their parents and wind up on the street. Many people in the room are probably familiar with the Night Ministry that has really great programs. They're not the only one, but they're probably the best known program to serve unaccompanied homeless youth, to make sure they're not out on the street being victimized. Governor Rauner is proposing to cut that program. So we really strongly support the revenue options that Ralph talked about, going back up on the income tax, expanding the sales tax to services, perhaps looking at some of the corporate tax loopholes that exist in Illinois and closing some of those, to make sure that we are, at least, while we're not adequately right now spending on efforts to end homelessness and create affordable housing, so we want to make sure at least in the next year we don't go even more further backwards, and we can really fix the state fiscal situation, so in subsequent years we can increase funding for efforts to end homelessness and to create affordable housing.
My name is Jack Wiest. I'm the Executive Director of the Alternative Schools Network. That's an association of small community-based schools started by organizations in their neighborhood to get young people who've dropped out of school to get them back into school. The schools are small, 200. They offer a real private, kind of a personal relationship, and it gives them a kind of family atmosphere they didn't have in the bigger schools. What I want to talk about briefly is we've worked together with groups on youth employment and the necessary kind of desperate need for young people to get youth employment. And I'll give you a few statistics that show that trend has been, in the last 13 years, that youth employment has gone down significantly, where about 50% of young people in Illinois used to have jobs in a year. Now it's down to about 25, 27%. What that means in terms of long-term consequences is kids don't learn the social skills and what they call soft skills, but also of having a job, attending, the excitement of having some money in their pocket, but equally as important, a lot of the kids who have jobs help their families, and the families then have some money in their pockets that, that can really help get through the scrapes they're going through. Some of the kind of dire statistics, and over on this side, I've got more of these reports that talk about the consequences, but also just basically the outline of the actual numbers. In Illinois, only 27% of young people in 2012-13 had a job. Again, 13 years earlier, it was about 50 to 55%. In Chicago, only 13% of young people had a job in 2012-13. Black teens, their joblessness, 16 to 19-year-olds, black teens, 90% of them were jobless throughout the year, did not have a job. In Chicago, 1/2 of all young black men in that period of time, 12 to 13, 1/2 of all young black men, 21 to 24, were not just jobless, but they were out of school. The New York Times had a front page article that I'll send Senator Hunter, that showed 1.5 million black men, they called them missing. They just were not in any kind of event of daily life. And again, think about 50% of all young black men, 21 to 24 in the city, doing nothing. Well, they're not just doing nothing, they're doing other kinds of stuff, but they're not in school and they're not moving ahead at the time of life where they ought to be grabbing life kind of like by the scruff of the neck and moving forward with hope and opportunity, and they're not going anywhere. The kind of consequences we see from this is very eloquently, candidate Barack Obama in 2007 in a speech talked about quiet riots in the inner city. And he was marking the time of the Rodney King riots in 1992. This is 2007. And I think that's what we see with the headlines in the newspapers, with young people who are shooting each other, the trauma that young people have from watching shootings or knowing someone who's been shot, and they are I think well worded as a quiet riot. But then we just saw in Baltimore a real riot where kids exploded and start doing things that nobody wants to see done, but it's a kind of a situation that it costs an enormous amount, not only to businesses and people in the community, but the kids themselves. And I think as everybody here on this panel has said, if you don't make some investment, if you don't provide the funding for education and training and employment for people who desperately need it, you end up with a cost that's even much greater. I'll give you one example. For young people who drop out and re-enroll to school and graduate, the cost savings over the lifetime of that young person, the cost savings in terms of higher wages and more taxes paid, lower incarceration rates, lower welfare rates, the benefits to Illinois taxpayers is over $300,000 over the lifetime of that person. So if you spend $10,000 a year to get a dropout back to school and they go for 2.5 years, you might spend $25,000. That's a great return on investment. I wish I got that in my mutual fund. You get $25,000 invested, and you get $300,000 over the lifetime of that kid, reinvested and brought back into the community. I'll say a few things that David Whitaker was here. We've worked with David and with the Black United Fund of Illinois, with Henry English and the Westside Health Authority and other groups, the Urban League of Chicago. We've had a hearing in last January 30th where we unveiled this report and showed that the necessary investments need to be made for young people who need jobs. Up until the year 2000, there used to be a summer jobs employment program paid by the federal government. Unfortunately, that was eliminated, kind of stupidly too. It would employ about 600,000 young people who were poor in the inner city. If you talk to some of the legislators and even congressmen, they remember the program. They remember when they were even on the program in the 70s and 80s. What happens is if you have that program, some kid will come in and get a job and maybe goof off the first year, but still get through the job. And they'll have a job through people that they know in the community, a community-based organization, and they have a relationship with them. The next year, it's going to get a little better because they know what it's like to have a job, get some money in their pocket, show up on time, those kind of skills. The third year and fourth year, it cumulatively builds those kind of skills that kid can then go out into the private sector and really find a job. It cut and eliminated in 2000. Now, in the last 6 or 7 years, Illinois has had a summer jobs program, some from the recovery money for the recession, some from the state. The previous administration had put together about $25 million for summer jobs. We don't see that right now, but we want to push on that there'd be $25 million again for summer jobs for kids in the inner city, not just Chicago or Cook County, but around the state. So again, you build those skills that kids can get the self-confidence and go out and find jobs. As the economy's picking up, they can find jobs in the private sector. We need to make sure those jobs are there. We need to make sure the funding is there. I think the good news from everybody here in this panel is that while things are in dire straits some way, there are clear steps to be taken. Dan showed how we can provide input to our legislators. Ralph really showed it's a really hopeful situation if the right steps are made to get the income and make the investment that needs to be made. The other thing I'll just say briefly is that Illinois, unfortunately, in this situation is not alone. Kansas, Wisconsin, Indiana, Michigan, all those states have seen dire pushes to cut services and redistribute the wealth in terms of taking money out of people's pockets and putting it to the 1%. We're not an isolated situation at all. I think we have a real opportunity to kind of show how this can be stopped here, and everyone here can make a real difference in terms of getting yourselves, your relatives, and the young people you work with to really make the 800 number call and get your emails into your legislators. So.
Wow, thank you, Jack. I've seen you over the years in Springfield in all the committee hearing rooms and on the rail and outside the doors, and I've learned a new Jack today. I'm telling you, Jack has I've always said he had a very serious look when you see him. He will always look determined and very precise on his movements and so forth. And so for me, that's why I love these things. You learn things, you meet people, you network, and you connect. And so I appreciate all of our panelists' insights and expertise. And now we're going to turn it over to you guys to ask questions, to raise issues, and I'm quite sure there's a few questions or issues that you guys may have on your minds and in your heart. Now, but if you need to go to that mic so we can get you very clear and succinctly on tape and so forth. So if you don't mind, we can go to the mic or either bring the mic to you.
Do you want to come?
Whichever's your preference. Yes, thank you.
Hi, my name is Tashiana Jackson, and I'm the DCFS Statewide Youth Advisory Board President. And I just have a question about the child care protection. Eliminating those services for 18 to 21-year-olds, and just me looking internally and noticing the impact it would have on our board members and both on the regional and the statewide levels, as well as the youth and care as a whole. But do you think that anyone ever takes into consideration the impact that it may have on staff members who are relying on this as their only job, or who have dedicated their life and their bachelor's careers to this?
Yeah, I think that's an excellent point, which I didn't make when I was talking about it, and I think it actually applies to just about everything we went over, whether it's Teen Reach or early intervention or all these programs. There's a huge impact on staff. You know, there's one of the myths that I think is being spread by Governor Rauner and people in his camp is that we have to make all these cuts so that Illinois' economy can boom, we'll have more jobs. But why are only private sector jobs considered jobs? Why aren't public sector? Why aren't teachers and firefighters and all these other people you're talking about? They all work too. They all, you know, they're all productive. They're all paying taxes and part of the economy. So I think we have that kind of fundamental difference about, you know, whether something counts as a job or not. But you're absolutely right. There'd be huge impacts on staff from these cuts and unemployment.
And to follow up on that, and not just huge impacts on public sector employment. So here's the reality. The private sector economy is what? It's consumer spending. It's you and me buying junk and such. 68 to 70% of all activity in the private sector is consumer spending. When state government cuts, what it's cutting is the wages and salaries of workers who then have less to spend in the consumer economy. So you know what they do? They spend less. And when they spend less, that creates private sector job loss. And in fact, for every dollar state government cuts in spending, the private sector loses about $1.31 of economic activity, as you're not spending your dollar at the dry cleaning, and so the dry cleaner doesn't have that income, so they don't spend their money at the car repair. It multiplies through the economy. And literally, every time there's been a peer-reviewed study that's looked at the impacts of tax cuts to stimulate the economy and the offsetting spending cuts needed to pay for them, whenever you put the two together, the net impact on the economy is negative. You lose private sector jobs. The tax cuts don't work. It is a lie. And there's no peer-reviewed study that shows it goes otherwise. The multiplier is huge, and the bottom line is simple. You cannot cut your way to prosperity. It's just the truth, and that includes the private sector, not just the public sector job loss.
And let me add on, now that Ralph's brought this to my attention, I'm leaving something out, which is that we're talking about what may be publicly funded jobs, but they're not necessarily public sector jobs. A lot of the services we've talked about today are provided by private entities. 75% in human services, Ralph's telling me, are provided by the private sector. So, and in terms of, well, it's publicly funded, well, so is Lockheed, so is, Boeing, so are all these places that employ people. They receive enormous amounts of public funds. So the fact that it's public funding, it's still private sector jobs. So it's not just public sector. It's, as Ralph says, 75% of the jobs that we would be losing through these cuts to human services are private sector jobs.
No, I just want to mention, we have a program, 3 programs that work with older DCFS youth. And we're hearing they're just getting in a panic, which is understandable because they don't know what they're going to do on July 1st. They're going to lose where they live. They're going to lose a chance to get employment. We provide employment, schooling, and it's just a real mess. And it's really hard for young people, the DCFS young people. That's kind of the untold story of what they're going through right now before even a cut exists. They don't know what their lives are going to look like after this fiscal year ends.
In the panic right now, especially with our board members, especially with all of us being youth in care, majority of us being in that 18 to 21 age group, and some even are so close to 18. It's just strenuous panic. But another concern that we were also wondering about is why the 12% increase in the Department of Juvenile Justice budget? Seems like it's enabling crime.
I don't really know about the increase.
We haven't analyzed the reasons why some of it actually is required by court order. We have understaffed juvenile justice for a long time. So it just may be catching up to court order on staffing levels.
Or maybe just another point as to, I know that there's a cut going to be made, but maybe just what can we do to suggest a smaller cut?
Yeah, the answer is fight for the revenue. The cuts aren't needed if adequate revenue is raised, right? And you can't just be, guts, no cuts, more revenue. You can't be that ambiguous anymore. You got to literally say, we support expanding that sales tax base to include services. We will support you, legislators, if you do that. We will support taxing some retirement income. Do it on a fair basis. Look at the CTBA proposal, whatever. But we support that. We support increasing the income tax rate. You got to be very specific on what you support, like we outlined here. A couple people talked about corporate tax expenditures. We support eliminating those corporate tax expenditures that don't make sense, that aren't generating a benefit for society. Say those things, And then if you really don't want to get bogged down in details, you could refer them to the RBC website. You could refer them to the Center for Tax and Budget Accountability's website. I mean, we've got all kinds of very specific revenue proposals out there, but you need to be specific enough that the legislators understand you are supporting these revenue proposals.
Support revenue. Choose revenue. Choose. I knew that wasn't right. Choose revenue. No cuts. Choose revenue is one hashtag, and no cuts is the other hashtag. Let me just say something here that kind of tags on to what Ralph was saying, which is that what you're going to hear from the governor and his supporters is times are tough, and this is the budget we can afford. Okay, they poll tested. That's a strong message for them. Okay, times are tough. This is the budget we can afford. Completely untrue. There's no truth to that. As Ralph showed you, the funding crisis that we have this year is almost entirely because of the tax cut that went into effect January 1st. And as Ralph also showed you, the vast majority of that tax cut went to the wealthy and big corporations. That's where the money went that should be paying for these services. And so what we need to do is say there's a choice here. This isn't what we can afford. There's a choice here. Are we going to let that tax cut stand with the benefits going to the rich, the wealthy, the big corporations? Or we're going to take some of that money back to pay for services? That's the choice you have. The choice is between letting the tax cut stand and not doing anything to raise revenue and allowing these devastating cuts to be made. But there's a choice there. That's the key point. There's a choice to be made. We're not backed into a corner. We're not in a position where we can't make changes to what the governor has proposed. It's a choice that we're making.
Tatiana, there's a lawsuit that was brought by the ACLU about 25 years ago. It's called the BH Consent Decree. And that's in federal court. And when there was an attempt to cut DCFS 6 years ago by $300 million, the ACLU went back into court, the federal court, and got an injunction against all of those cuts. So, I mean, two things for your advisory group, youth advisory, I would say one is, again, call that 800, have them call the 800 number, and they can really make a difference. And talk to their legislators, because as much as we talk, when they hear from a young person, it makes a whole lot more difference, just a whole lot more difference. And the other thing is just to let them know there is some hope, because I can't speak for the ACLU, but I think they're going to go in on a lawsuit, on that consent decree again and stop these cuts if it can't get restored in the legislature.
Well, I know currently House Bill 3507 is looking to make the BH consent decree law.
Yes, my name is June Ward. I am very concerned about all the cuts in the programs with mental, because I suffer from mental illness. I was homeless. As I vote, I brought my voting card because I vote all the time. But my issue is this. I live in public housing. 5 years ago, I was homeless. So I know about all these cuts. I gave up my permanent housing because I had that instant that permanent housing in the future was going to be cut. So I went to federal housing, which I went to CHA, where I'm at now. Okay, but my concern was I had this mental illness going on ever since I was a child because I was molested as a child. I had been incarcerated because as an adult, I was raped. And I snapped. So I go to these programs like mental health counselors and everything like that, and then you hear on the news all these programs getting cut, like I heard on the news is mental health group C4 was getting cut. They out the door. And like I think the gentleman said, Ralph said, all these cuts is really hurting the poor peoples. My thing is, since I have been struggling for so long, been homeless, and has been a victim of molest as a child and coming up as adult, they cutting everything. Nobody have programs for peoples who be in public housing and still get sexual harassed like I'm dealing with. Okay, I feel that that's a violation. When I brought it to light, the CHA, they don't want to address the issue. I've been with various agents to help me resolve this issue when I brought it to light, because it was one of their staff, not CHA staff, it was a contractor that CHA have. The guy was sexual harassing me for months in uniform. When I brought it to light, they came into my apartment and vandalized, damaged my bike, my vehicle. And you know, how long do a person have to keep on being reminded of the past, and they trying to cut all these programs for mental health and everything like that in housing, and I'm trying so hard to fight for my housing so I don't be homeless again, because that's not a good feeling, that you have to carry your luggage, your bag, everywhere you go, and you have to come to some of these facilities at a certain time at night and leave early in the morning. Where could you go and you homeless? And then just to keep on being repeated from sexual harassment from public housing, and they keep on covering up, and it's supposed to be fair housing. I don't see anything fair about that.
Well, let me try and respond. So, and thank you for sharing your story and all, you know, the hardships and crisis you went through. And I think your story is an example, though, of how, you know, people with very low incomes struggle with a, you know, complicated system interacting with different types of public services, that none of which have adequate resources. And public housing is funded, the CHA is funded pretty much all exclusively by the federal government, so probably easier if I talk to you after the meeting to address your specific situation. But it just goes to show that, you know, in terms of the broader safety net, to make sure people have adequate resources to stay in housing and to have the mental health services they need, or childcare, whatever type of services they are, that, you know, both at the state level and at the federal level, you know, they're currently woefully inadequate. So Governor Rauner didn't cause these problems. He's making them worse, but just getting back to where we were and having no cuts isn't going to solve all the problems. But in terms of the short term, that's what our focus needs to be on over the next, like, 2 weeks.
Good afternoon, good morning to those that are just arriving.
Sir, I'm sorry, let me just finish responding to her question, which is I can talk to you afterwards about a legal services referral if you're interested.
Let's switch these mics real quick. Give you a chance 1 second, okay, sir? I just want to switch. I'll take that one. Sorry. Thanks. Oh, yeah, go under the front guy. Or you know what? Put the microphone around your back and your hand and go.
Okay.
Thanks.
While he's doing that, if you haven't gotten a copy of this report, I'll put a few more now on the table.
As I stated before, my name is Ralph White. Good afternoon to everyone.
Good afternoon.
The panel, you've been very eloquent in distributing good, positive information which we all need to share and have here in the community. I'd first like to start off by stating that I can sympathize with everything that the prior young ladies came up and stated and spoke on. Me, myself, I've been here in Illinois since 1968 from St. Louis, Missouri. At the time that I've been here, I've had my ups and downs. I've gone through some good times and some bad times. But what I have learned about Illinois is that Illinois speaks with a lot of positive input about what could be. But what I've also seen from their speaking is a lot of times they don't want to stand behind a lot of things that they speak out their mouth. I'm talking about our politics. I was politically inclined at one time for the simple fact because I'm very caring to the community in which I live in, or any environment I happen to be in. It's easy to state to an individual that doesn't have that you could aspire to have this or have that, when in all actuality, you're not doing much of anything to really stand with that individual to take them by the hand and show them how they can go about doing it. Because you can tell a person anything, but you can't, if they don't have the experience or the knowledge to do any of that, it's just like you didn't say anything at all. So to be eloquent and precise and abreast and experienced with the political spectrum, it doesn't mean anything to the poor man or the poor woman or the poor child that doesn't have any understanding or any education or how the system works. You have to get down next in the mud with us. Some of us need to be led by the hand. Some of us need to be told time and time again, this is what you need to do. And theoretically, for us to be followers, we need to see you walk the walk. Now, I know for myself, soon to be 62, that Governor Rounder, in the proposals that he's making now about the nursing homes, bringing people out to nursing homes, reason I know that that's a lie, because me and my wife ran one of those houses where they sent people with psychiatric problems and were getting back into the mainstream of life, coming out the nursing home. We ran one of those houses for 2.5 years. The landlord is a slum landlord. All he wanted was those patients and individual recipients' finances that were on disability or that were getting money from the federal government because they had a mental instability. And they didn't have adequate nursing caretakers to come in and consistently address their mental status, because in all actuality, a lot of them shouldn't have been let out the nursing home to begin with, or the psych wards. They put them up out of those places just so, because they don't have the assets in which they can hold on to and grab onto and control. That's why they put them out. So they send them somewhere where somebody else can have the burden of their problem. And when they sent them to us, some of them they tried to get along. They tried to do which was suggested to them in order to get back into the mainstream of living. But if you have a severe psychiatric problem and you're not a medical expert to handle psychiatric problems or to administer the proper psychiatric prescriptions to those psychiatric patients, you're not going to be able to control their behavior, for one, in the mainstream of life. And the older ones, the seniors that do come out to nursing homes that they're tired of dealing with but don't have family but do have somewhat of an income, they're on their deathbed. So they don't want to be involved with what do I do when these people die? I also been in nursing homes where I've had good young friends that the nursing medical field did not tend to, that they took an oath for, and they let these people die because they didn't want to be bothered with them because of their race. Now, my question to you is, since you say that the cuts are not really going to be a big issue, why is it that the politics can't cut the transportation that they give that the taxpayers pay for? Why can't they use their own cars to go to work? Why can't they not have coffee makers and things at the state level and federal level that the taxpayers paying for? Why can't they just phase that out? All sorts of things like that will save tax dollars.
Well, let me try and respond, and actually maybe I'll turn it over in a second to Ralph, who can talk about this constant call for cutting waste, fraud, and abuse, and kind of how that's not going to result in the savings that you think it will. But you raised a broader issue that kind of goes beyond, Governor Rounder's budget proposal and the state budget right now. But in terms of, kind of bad overall priorities, both at federal and state spending, you talked about people in nursing homes. So when somebody's in a nursing home, obviously a big cost of them being in the nursing home is paying for the housing, paying for the roof over the head to keep the lights on, paying for your food and your other costs. So that's all money that the government pays for through healthcare dollars, through like Medicaid and Medicare and so forth.
Only if the person doesn't have income themselves.
Right. So, but when you talk about providing housing to people in the community, none of those healthcare dollars are available to cover the housing costs that are related to the person's healthcare issue. So we're desperately trying to find other ways in the state budget to find those dollars for housing for people who have serious healthcare issues. So again, this is long-term beyond Governor Rauner's budget proposal, but it would really make more sense if we could spend some of that healthcare money on community-based housing so that we wouldn't just have to rely on or disproportionately rely on, you know, slumlords and people who aren't providing good housing. So.
Right, right.
All right, so I almost wish there was a line item in the budget for waste, fraud, and abuse. So we could just say, here's what we're going to waste, fraud, and abuse this year, and let's see if we should increase it or cut it, right? I mean, that it gets so much coverage, but it so much misses the point. I tried to get on for you to see the hard numbers are the hard numbers. We have inadequate resources on the front end to make the investments necessary to get good outcomes on the back end. It is that simple. And they could magically eliminate all waste, fraud, and abuse tomorrow, and our budget deficit would decline from 10.2 billion roughly to maybe 10. You wouldn't get the money you need to make an iota of difference. And one of the problems with the whole waste, fraud, and abuse thing is it's used as a red herring to distract voters and constituents from fighting for what really needs to be happening at the state level, which is more revenue, tax increases. See, politicians love it if you talk about waste, fraud, and abuse because it allows them to say things, well, I can't talk about tax policy till we fix all that waste, fraud, and abuse. Before I did this job doing public policy, and Ralph, I gotta like you because your name is Ralph. And there's maybe 8 of us left in the world, and so you and I, we need to form a club. Politicians hate dealing with tax policy. They love to have an excuse not to. And by all of us talking about waste, fraud, and abuse, which is not the cause of the problem in Illinois, is it going on? Yes. Is it going to go away? No. It's never going to be zero. How many of you have worked a job in the private sector? Anybody here have a job ever? Was there waste, fraud, and abuse on your job? Yes. We think the public sector is going to have this magic pixie dust that makes all people be honest and not steal and do bad. No. And the biggest problem here is that it's really used to stop us meaning us, from organizing on revenue. So while I'm all for them being as tight with the taxpayer dollars they could be and eliminating every penny of waste, fraud, and abuse, I understand 2 things by looking at the numbers. Number 1, even if they could, it wouldn't make a difference. It's not enough. And number 2, they won't. So let's not let that problem stop us from focusing on really stopping the investments that our communities, our families, and our neighbors need. And it's bad tax policy. So let's go fix that.
My name is Cliff Frazier. I'm with Program Renew, which is the New City, Inglewood, and West Inglewood Community Coalition. I do want to thank all our panelists here and our senator in her absence. My brief question is, with all the discussion we've just had today on different cuts from the budget, have there been any discussion on actual programs that have been increased this year? And is there any justification on why Program A was increased this year versus the massive cuts that we're discussing?
Yeah. So there was a modest increase to K through 12 education proposed in the governor's budget, but it's not even all that because a lot of that quote unquote increased is paid for by cutting or eliminating other special funds that used to not be in the general fund that funded education anyway, right? Okay. But there is a modest increase in K through 12 education. And when I say modest, it's roughly $300 million in change. You're talking about overall a 20-some-odd billion-dollar enterprise. Right. This isn't even a rounding error. There really aren't increases in most core services. Now, one small program may get an increase while 9 others are cut. It's just simply not a sustainable way to go. And I think the bigger question you're asking is, has there been any sort of analysis done to say, hey, we're going to cut these programs because they're not really very good, and we're going to shift the money here because we have tough.
Right,
That's not what's going on at all. In fact, Newdig, who's the governor's budget director, was recently quoted in the paper as saying, what we're doing now is cutting good programs because we just don't have the resources to fund it, right? So this kind of analysis, this thoughtful analysis of, gee, maybe that program's, it's not going on in the first place. They're just making cuts because they don't have enough money. And then I'm going to say one more thing about not having enough money to get you all to fight for tax reform, more revenue. You're going to get false negatives if you look at current programs and say, wait a minute, this program is supposed to be accomplishing whatever it is, X, and it's not getting to X, it's somewhere below that. Well, has anyone asked the question, does that program have adequate revenue on the front end so it has the capacity to generate the outcomes we need? And the answer is going to be no. We have a whole system in Illinois, they changed the law a couple of years ago, called budgeting for results, that's supposed to be looking at these outcomes, but they specifically don't ask the capacity question. Governor Quinn asked me to be on the task force that was putting together the budgeting for results recommendation. And I said, can I ask the capacity question as part of this task force? Could we say part of our analysis has to be, are we giving service providers adequate capacity to actually do what we want? Oh, no, we don't want that question asked. I said, well, I don't want to serve on the task force. Because all it is a beard for cuts, right? So your bigger question is, good government analysis isn't happening, and it isn't happening because we're starved for resources. So let's get adequate resources in and then have the discussion about the best application of them to the programs that really deserve them.
Thank you.
Good afternoon. My name is Curtis Harris. I'm a disability rights advocate and volunteer at Assist Living and the co-coordinator of Disabled America's More Work Now Done. I have some questions I want to ask as far as did Senator Hunter voted SB 342 for home services and opposing the determination need score. And I have a story here is that I've been suffering from mental-related issues like depression, anxiety disorder. I've been going to thresholds for 8 years. I have non-linear recovery. I'm getting better recovery, and they have helped me get a temporary job at this company of Assist Living for 1 year. As I got interviewed for the job, I worked with my support employment specialist. And now the government wants to cut everything. He wants to cut funding for mental service, including support employment. Well, if the government make those cuts and goes through, I'm not gonna have anybody help me find a job and keep a job. I'm on a waiting list to live in unsupported housing at mental health age called thresholds. I do want my own apartment. I might need some help. If that cuts go through, I'm gonna be living with another family member for the rest of my life. And lucky me, if one for my supported family, I'll go into a nursing home. I just want Senator Hunter to vote for SB 342 and oppose the DON score, determination need score, stands for DON. And I'm just concerned about these cuts that the governor's making to go through. I know you heard say that the state said we don't have the money to fund it. The governor does have money to fund these services. He just don't want to. He can give tax rates to his 1% billionaires and millionaires and have loopholes sending jobs out of the state, maybe overseas.
Thanks. You should have been on the panel to tell your story.
Good morning. I'm Sister Angie Kolosinski, and I represent a parish in the back of the Arts, Holy Cross Immaculate Heart of Mary. We have several youth staff members here. We've hosted a Teen Reach program for over 14 years. And one of the things that we've done is train our staff in youth development techniques, et cetera, et cetera. And one of the important things of youth programming is a safe environment. And some of that includes boundaries, expectations, et cetera, et cetera. When the governor cut our funding April 3rd, our parish chose to keep the program open because it's essential for our neighborhood. We have 14 years of success stories. My question is about the budget timeline. You know, as we look forward to summer programming, et cetera, cuts, where do we go, what do we do? I know that the budget is supposed to be passed by May 31st. I guess I'm asking what your sense is of the likelihood of that, and how long could that stretch out? I think it's helpful for us to know. Thank you.
The answer is nobody knows, but the chances that this will be resolved by May 31st are very slim, I think. And it's going to go on because not only do we have to get a budget, which means we have to get the spending and the revenue to match, but Governor Rauner has this turnaround agenda, which has nothing to do with the budget, but there's a lot of anti-union items in there, like right to work and what are the other ones? I'm drawing a blank.
Workers' compensation.
Workers' comp, tort reform. Anyways, Governor Rauner has a lot of ideas for big changes, which the Democrats don't like. And those would also, he wants those resolved as part of the budget, because otherwise they won't be considered. The parties are so far apart on all those issues that it's hard to imagine it could get resolved by May 31st. We've got, this summer is going to be pretty crazy because the union contracts expire at the end of June, July 1st, so the AFSCME and the SEIU contracts and who are the big public employees, so that's going to be layered on this. I think the people I've talked to thinks it's just hard to imagine how many things are going to be crashing into each other, and we don't know when the budget will get resolved, and it'll be impossible for anyone to plan, for you or anyone else to plan.
Yeah, I think if I were you, I'd be planning for a delay at best, right? And there are some who believe that the governor does want government to close because he could utilize that as a negotiating tool against the unions as he goes into these collective bargaining talks. So that's number one. And number two, part of the ammunition for this thought that the governor does want to see government shut down and hence funding for your program delayed significantly, is he went to every department head after first putting them in office and said, come up with your strike plan for having 0 workers. Not, where's your budget, what are your priorities? It's come up with your strike plan. That was the initial directive given to each person put into head the major agencies. So we could always be surprised, and I can't emphasize enough that Dan's 100% right. It could happen by May 31st. I mean, you never know what the reality is, but it looks bleak at this juncture, right?
Yeah.
We got 2 more
I
questions.
just wanted to say thank you to all of you for your analysis and sharing with us. Thank you.
for being here.
Thank you for being here. Yeah.
2 more questions and we're going to wrap this one up. Thank you.
Thank you. That was really interesting. My wife really thinks I'm just a wonk because I came here on a Saturday morning to listen to a tax policy. I just wanted to say that, one, I probably represent a minority here, but I do pay a lot of taxes. And I have to say, Ralph, I do agree with you. One point I'm going to totally disagree with you on, but one point you're right. I didn't even know we had a tax cut, quite frankly. So at a certain point, when you do make a certain level of income, you don't really notice. Like the fact that I didn't even know it went to $375. So it is, when you do make the cut, there's only so much I can spend on food and housing and going to the movies. There is a point where we do have to invest. I've made a great use of the public school system. My son went to Walter Payton. I serve on the board of the endowment now to raise money for the school, to fund some of the cuts that we keep getting hit with at the school. But there were 2 things that you said that I wanted to clarify. One, you said there was nothing you could do about the pensions. One, I'm not sure how you talked about making it, because every analysis that I've seen from J.P. Morgan.
Nothing you could do about the pension benefit.
Well, that's not true.
Yes, it is.
Well,
I can stop you.
No. You can amend the Constitution.
No, you can't. You can't stop, because I've got the answers. We've had this analyzed. You can't amend the Constitution to take away rights on an ex post facto basis, looking
But
backwards.
who says?
U.S. constitutional law?
But this isn't U.S. constitutional law. This is state
The
constitutional.
state,
This is a
the state
very
is, we
different issue.
can't, no, it's not.
It's-
No,
it-
it's
it is
not.
not. In
The
fact,
U.S. ex
no.
post facto protections apply, number one. Number two, you could
What- so
only
you're
change
telling me-
benefits on a going forward basis for new workers hired after the change in law. That is it.
Okay, look, I've read different analysis that disagrees with what you said.
Yeah, and
That-
so far we've been, so I'm just going to push back completely. We've been exactly right in our analysis. We called the Supreme
Well,
Court
no, you're
decision.
right. They were wrong to go with
Not
the
only,
law,
not only
the way
did we
the
call the
Constitution's written.
Supreme Court decision, my organization was cited in it. You look at page 14. The bottom line is, our analysis here, we've been the only group that has consistently said, here's what our Constitution will and won't allow, here is how the state Supreme Court's gonna interpret it, and we've been exactly right. And I'm telling you on this point, you're not gonna cut the benefits. The simple solution, and it is simple, it is a matter of law, re-amortize the debt. You can't have a payment structure that grows like this, because taxes don't grow like that over time. Flatten it out.
Yeah, but every analysis shows that we're going to go out in about 15 to 25, depending on who you look at and what the actual return on the investments is, that we're going to run out of money.
No. So if you redid this, so we've run the numbers. So once again, you re-amortize it, you get your debt service level to about 7.2 billion a year. We're already at 6.8. You get it to 7.2. It takes, you can't do it in 30 years. It takes about 41 years. In 41 years, you're 100% funded. In 30 years, you're 78 to 80% funded, and according to the Congressional Budget Office, you're healthy at 80. This is accomplished while meeting all cash flow obligations of the pension system to meet benefits to workers, and is undeniably constitutional. It costs about $4 or $5 billion less than our current law, and it's a matter of state statute to change.
But what actuarial rate of assumption do you use in terms of returns?
We use the ones pegged by the state, but they're discounted. But number one, they're discounted, and number two, you understand.
What's the rate?
The base discount rate is 7.6 right now.
So you have interest rates.
No, will you let me finish the answer, because I'm going to tell you,
Why don't you guys talk after?
Okay, really quickly. But no, he's raising issues that people raise that are just flatly wrong. And I want to put that out there, because you can't be dissuaded by these arguments that sound rational but aren't. So, we have run those numbers and had them peer-reviewed by the actuaries at the retirement systems that say our numbers are accurate. We have a discount built into the discount rate. We understand that an undervalued system doesn't get the return that a fully valued system would get. We've run the numbers to that point of accuracy. Number two, you do know that going back 30 years, the aggregate rate of return for our 5 public employee pension systems is almost 8.5%, right?
Yeah, but you're starting from a much different interest rate environment. You're starting now near zero.
No.
I'm an investment professional. This is what I do
No
for a living.
short-term
You're telling me
blip
that
matters.
30 years ago, interest rates were over 10%. They're under 2.
I'm telling you, the actuaries agree with our numbers. And so I don't,
You know what
I
an
think it's
actuary
great.
is? An actuary is
I
just
think it's
someone who
great that
looks
you're in the
2 ways
investment
down a
community,
one-way street.
but the actuaries agree with our numbers.
Okay, the second point, I did have a second point, because you said there was no waste. The
Yeah,
second
and
point.
I said that there is waste.
There
We
is
have to
waste, but
eliminate
I had a question, because I was hoping the senator and representative would be here.
Yeah.
But what about all of the local taxing districts we have in the state?
over 7,000.
I mean, so don't we spend billions in that?
Okay, no, so it's highly inefficient. We have one of the most inefficient systems, and does that need to be cleaned up? Absolutely.
Well, that's what, because doesn't it come from property taxes? Am I
Mostly. But here's the thing when you look at that. So you want to look at the actual cost that inflicts on you statewide compared to other states, the inefficiency of your system, right?
Mm-hmm.
So if you look at total state and local tax burden as a percentage of income in Illinois, which would include every local tax and fee,
Yeah.
right, as included the state compared to the others, we currently rank 27th in the nation. But that includes the revenue from the temporary tax increase. You take that out, we drop down to 42nd.
Okay.
We have the 5th largest population and the 5th largest economy. So while it is distorting and it does cost taxpayers money, it's primarily at the local level, number one, and number two, it still doesn't make us high tax overall.
No, I agree.
That's the problem.
That's an issue that I've looked at in the past.
It's one I really wish we could
let go.
resolve.
Ralph, I will talk to you later.
If you have a question for the senator specifically, if you would email her, she will respond to you directly, sir. Yeah, I guarantee
Good
you.
morning.
Good afternoon.
Well, good afternoon, right?
Yeah.
I got a question and a comment. My name is Paul Burns, by the way, and I'm with the Metropolitan Tennis Organization. I'm a
I'm
housing,
sorry, with whom?
Metropolitan Tenants Organization.
Thank you.
And there's been a whole lot of talk this morning about dollars and cents. But every one of those cuts that came across the board affects families and lives. And I started out, I used to organize in market rate buildings. Now I'm in subsidized HUD buildings, CHA properties. And it's amazing how every cut that was on that board will affect every family in some properties. And some of these properties that I'm in, 2,600 units alone, 5 different phases. My question, and it's not facetious, it's very serious, is what grassroots organization locally can we be a part of to stop what's going on? Because in these communities where these cuts are going to happen, it's going to totally obliterate them. It's going to wipe them off the map. They are going to have to put a statue there and say, this is where black families used to be. They're going to be like dinosaurs. This is where Latino families used to live. And I know we have pontificated a lot this morning about tax cuts and about what we can do about that. But when I say it's a serious issue, I don't know how you got elected in the first place. I'm just going to say that. But when I say it's a serious issue, and this unholy matrimony between our mayor and downstate, what locally can we do? Because organizations and operations where people are living in housing that they can afford to eat, they're already above the 30% payment struggle in public housing. They're already above that. What can we do?
Right, well, Dan's group and my group and about 200 more groups around the state are part of what's called the Responsible Budget Coalition. I think actually the Metropolitan Tenants Organization is a member of that too. And what we're trying to do is build and have been doing, is building and expanding a coalition of community-based organizations from all around the state, not just in Chicago, but we recently had a press conference in Rock Island and Peoria, and there's one next week in Carbondale, engaging community-based organizations and individuals in these discussions about how we need more revenue to pay for not good services, not ideal services, just to pay for adequate services and avoid the budget cuts. So we do have a Facebook page. Just search for Responsible Budget Coalition. If you're on Twitter, have the hashtag #ChooseRevenue. Dan, do you want to give the 800 number once again?
Well, the 800 number is to contact your senator and representative. It's 844-311-2887. But if anybody wants to get on the mailing list, the email list for the Responsible Budget Coalition, you're welcome to do that. You can actually email me and I'll get you on that. So I guess I should give you my email. It's my name, Dan Lesser, DANLESSER, at Poverty Law, that's one word, POVERTYLAW.org. And we'll get you on the mailing list. It's, as Bob said, it's a umbrella group coalition of organizations, but we also are happy to put individuals on the email list and kind of keep you apprised of what's going on. One thing we report on is actions that are occurring, which is rallies, things of that nature, and that's something, the more people who go, the better. So we keep you, and this comes out weekly. We have a little newsletter. So if you want to contact me, we'll put you on the email list for that.
Yeah. And that's more of a coalition and coalition work. If you want a grassroots, the Chicago Housing Initiative, right, is a collaboration of grassroots-based housing activists and organizations. And you may.
MTO is part of that.
Yeah.
Yeah.
And we've provided some technical assistance to them, but I know that they are willing to get down and dirty right in the community and help with that. So you may want to look into the Chicago Housing Initiative as more of a grassroots in your community sort of group that you could tie into and work together with a bunch of like-minded folks fighting for social and economic justice through adequate and well-informed housing policy, I think is a good way to put what they do. I've been very impressed with them and how they go about their business. And I can't reiterate enough, the Responsible Budget Coalition, to which we are all members, is really pushing that revenue message at the state level.
Wow. Thank you. Whoa, thank you. Listen, it's 12:10. We promised to have you out here by 12 o'clock. I want to say thank you for just taking out all your precious time on being here this morning and through the early afternoon to have this discussion. I've gotten about 5 texts from Senator Hunter. She's asking what's going on. So I got to text her and let her know that you guys came and participated. You was here. I think everybody in this space is in the right room at the right time for the right reasons. I had heard the other day someone say that people have positions, but the people have the power. And so I think it's upon us to exercise our power at the grassroots level, at the policy level, at the budgetary level, at the tax levels, to make sure that those statues do not get erected. That there was, some time ago, peoples used to exist. No, we're going to fight that, you know. And so I'm obligated according here to say a few thanks to Mr. Bill Tyre from the Second Presbyterian Church of Chicago. This is a wonderful place for hosting us here. We need to give them thanks. And to Chris Wilkerson from Can TV. That's Chris there. He's been, yes. To Kathleen Mosley, the photographer who just wrapped up and she was taking pictures and videotaping us. To Jeffrey Reed. Jeffrey here has been so faithful. To a lady by the name of Samantha Williams, who's down in Springfield. We won't see her here probably today. And most importantly, to Janice, here, the senator. Just let me say, Senator Hunter is texting me by the second here. She want to make sure that things have taken place, and I can report to her that we was here, we talked, we shared, we now know some things, some steps that we can take. And I really want to say that, to that quote again, people have positions, but the people have the power. And I think that if we exercise our power, we'll get to where we need to get to fight for the health, interests, rights, and needs of our people, to make sure that they don't get disappeared upon, you see. I believe that we have the power. And it's our obligation to take this information and go forth and exercise our power to bring about the change that we desperately seek to have happen.